Good afternoon. I need to get a little organized. Before I start my update, I will translate Dr. Monday's presentation of case numbers in our community. Muy buenas tardes. Mi nombre es Janette Ángulo, Directora del Departamento De Salud Pública del Condado De Imperial. Voy a dar un pequeño recuento sobre cómo está la situación en cuanto a los casos en el Condado de Imperial. Hasta el día de ayer se habían hecho 6.891 pruebas de COVID-19. De esas, 5.906 han sido negativas, 985 positivas, y de esas 985, 532 casos son activos. Se refiere que algunos de los casos o están en casa recuperándose o están todavía en el hospital. De los 985 casos, ya van 434 casos de los que ya se recuperaron, y lamentablemente 19 personas han fallecido. Habló un poco el doctor Monday sobre las personas que han fallecido. En su mayoría han sido personas mayores de 70 años. También la capacidad de los hospitales. Ahorita se encuentran 60 casos de COVID-19 positivos en los hospitales. En cuanto a las camas de cuidados intensivos, hay 8 disponibles y hay 18 pacientes en camas de cuidados intensivos. Los ventiladores, hay 63 ventiladores entre ambos hospitales, de los cuales 35 se están usando y 28 están disponibles. Dr. Monday también habló sobre el índice del condado, que es 40.1 por 100,000 habitantes, y es más alto del estado de California. I will go ahead now and do the my report. My report will be divided in a couple of sections. We'll first talk about our Emergency Management Services Agency response to the local hospital surge experienced May 18th and 19th. On Tuesday, May 19th, the Public Health Department's Emergency Management Services Agency was notified by the El Centro Regional Medical Center that they had experienced a surge of COVID-19 positive patients in a 24-hour period. Between the two hospitals, there was an approximate 27% increase in hospitalized patients between May 18th and May 19th. As of the 18th, there were 93 hospitalized COVID-19 patients in Imperial County. At that time, El Centro Regional Medical Center made the decision to go on diversion. Diversion is a routine practice in which the emergency department, for a specific period of time, stops accepting ambulance patients that they would normally accept. This typically occurs when a hospital experiences a surge of patients of any kind. During the diversion, a hospital's emergency room remains open to walk-in patients. Diversion is not the closure of a hospital. On the 19th, when the Emergency Management section of the Public Health Department received notification of an increased number of patients, contact was made with the California Medical Services Authority to request an ambulance strike team. Strike teams arrived in the county approximately 2 hours later. The Emergency Management Services section of the department also requested access to the state's All Access Transfer Center. The All Access Transfer Center was specifically set up to manage COVID-19 patients in California. The All Access Transfer Center and the ambulance strike teams provide hospitals a single point of contact to identify hospitals throughout the state that are able to accept COVID-19 positive patients and that have the ability to accept the most ill patients. This transfer center is able to distribute patients across Southern California's healthcare system in order to limit the impact on healthcare systems in the immediate surrounding areas. Additional staffing for the hospitals. The Public Health Department's EMS agency continues to work with both hospitals, as well as state and federal partners to secure additional staffing for both hospitals. In days past, a team from the California National Guard conducted site assessments for a setup of a potential federal medical station and met with both hospitals to discuss options for additional staff. Medical teams started arriving Wednesday, May 20th, and will be available for at least a minimum of 2 weeks. Medical teams consist of critical care nurses, medical and surgical nurses, and respiratory therapists. The Federal Medical Station. That station will be set up at the Imperial Valley College Gymnasium. The medical station will be an 80-bed medical unit where local hospitals will be able to transfer some patients who are less ill for care. The FMS will be available for patients transferred from the hospitals only. The public will not be able to go directly to the FMS for care. The Public Health Department's Emergency Medical Services Agency is working with state and federal partners to staff the Federal Medical Station. Equipment and supplies are scheduled to begin arriving on Friday. The date that the FMS will begin operating has not yet been determined. The site will be set up by a team from the California National Guard. Common question we get is the impact of Mexicali on our local hospitals. There may be an impact, but it's difficult to quantify and put an actual number to it, given the unique dynamics of our border community. We are a binational community. There's a lot of interaction, both northbound and southbound, every day in our regular lives. We have US citizens or persons with dual nationality who reside in Mexicali, but work and seek services in Imperial County. COVID-19 case count in Imperial County. That's also been a common question. The question has been whether or not the cases from other counties or countries, specifically Mexico, are counted in our daily numbers. The number of cases reflected in our COVID-19 dashboard are only cases of Imperial County residents. All cases are first investigated by the Public Health Department's epidemiology section. Verification of residence of cases is required for the delivery of isolation orders. Cases who reside in another county are not counted. The same with the cases who reside in Mexicali. Those are reported as out of country and not counted in local numbers since they are not county residents. We also report deaths of individuals who are Imperial County residents only. I will proceed to give the report in Spanish.